My name is Tom Wang, president of the ProCure Proton Therapy Center. As the longest established proton therapy center in the tri-state area, we have treated over 5,000 patients. To date, we've treated over 750 pediatric patients as well, and we've come across every challenging situation, but through and all, our doctors, our physicists, our clinical staff have seen and have treated the most complex cases of cancer. The ProCure difference is that for our facility, it is a freestanding center, and we are situated outside of a hospital setting.
When you come to ProCure for treatment, you're going to feel like you're in a family's home. The people are going to treat you like with a name, not a number. You're going to walk in, Bill, how are you today? How was your week? How did this go? And you're talking back to them the same way. During my treatments, I felt no side effects. Being an avid hiker, I thought once I started this, there goes hiking for the next couple months or whatever, and I expected to even have to not be hiking after my treatments, maybe a cool down period, we'll call it. Never happened. I could go every weekend, except for that little laying under that beam of magic coming out of there. You don't feel any different.
Proton radiation is really just another type of radiation, but the major difference between proton therapy and other conventional radiation is that we're able to stop the beam at a specific depth within the body. Proton therapy delivers far lower doses of radiation to the normal surrounding organs because of its absence of any exit dose. Pencil beam scanning is another advanced way to be able to sculpt the radiation dose to exactly where we want it to go. So it uses tiny beamlets of radiation to basically paint the dose to where we want it to go and to prevent it from going to places where we don't want it to go. The benefits of proton therapy really come in minimizing the long-term serious complications that come after radiation treatments.
I trusted ProCure because the staff seemed to know what they were doing. The doctors seemed to be really concerned, and so I felt very comfortable. I didn't want to go to any place else. It made you still feel like you're alive, and this treatment is going to do great things for you. Treatment was very fast, roughly about 10 minutes. I was in, I was out, and on my way back home.
When my doctor recommended proton therapy, he indicated to me that this was newer technology, was much more accurate.
In fact, the doctor was so confident in proton therapy that he said that he would recommend his own father for it.
I was amazed that the pinpoint accuracy of the beams were going to target the affected areas of my body and not have any kind of collateral damage to the other surrounding organs, especially being that the prostate is right nestled in amongst a lot of other sensitive areas of my body.
He had no side effects. He wasn't tired. It was really, really easy on him. At the end of his treatment, Dr. Chan said, he's cured. It's over. It's done. That really did give me a lot of hope. That made that, wow, I was like, cured? I never heard a doctor say that.
Once the patients are here for treatments, they notice that there's a calming effect. The waiting room in the lobby is very well appointed and calm. All of the nursing staff are available at a moment's notice for any questions or concerns that patients might have. Treatment times are relatively short. The radiation beam is only on for a few minutes at a time, but patients will generally spend about 30 to 45 minutes here at the center.
I'll never forget when I had my opportunity to ring the bell signifying my graduation or my completion of treatments. And they were inviting you to ring that bell, the staff. They were just as happy as I was about the treatments. Most people hit it one time. I think I went about 5 or 6 times. It was just a good feeling to know that your treatment was over and that everything had worked out well.
You know, you don't feel different. You don't feel your prostate in you. You don't feel anything. You're normal. You're you. All of this prep work that they do to study the prostate, where the cancer is in the prostate, and it's like a diamond cutter. He looks at the diamond, he studies it for maybe a couple of years, and then he finally takes his little chisel and goes, whack, that's it. One shot, and it's done.
We can treat probably close to 130 to 150 patients per day. We provide all the necessary resources for them to be able to take care of their body, to focus on the clinical treatment, and we worry about everything else. We handle whether it's transportation needs, to housing needs, to financial needs for the patient, any extracurricular things that the patient may need to make sure that they focus on their body, they focus on staying healthy, and they focus on their care. My vision for ProCure is to make sure that patients who seek proton therapy can and will have access to this incredible treatment